Hey, deserving listeners, Amber Heard, Johnny Depp trial. Let's watch. My name is Dr. Kirk Honda. This is the Psychology in Seattle podcast and YouTube channel. Let's watch.
Forensic psychologist, and I think that's where it seems that Dr. Curry seems confused. We have forensic assessment instruments. Those are instruments that are very neatly tied to a legal criteria. Those are most notably done in a criminal court for competency. If someone has competency to stand trial, we have very clear measures that can track that legal criteria.
Okay, so she is responding to Dr. Curry's criticism of her methods. She is delineating between different types of measures used in forensic psychology. Dr. Curry was saying that it's unethical to use forensic irrelevant measures, such as self-report measures that don't have the ability to detect, and it's not designed to detect whether or not someone is lying or not. And if you did use those, you should be very clear to the fact finder that these instruments are in fact just a reflection of someone's self-report and should be not regarded as a forensic instrument. And what Dr. Hughes is saying is that it's not unethical to do that. She's saying that she was using a standard forensic investigation, examination, and she was using multi-methods. I think what she means by that is using measures that are what Dr. Curry said was more subtle, meaning that they're not dependent on self-report. If people answer honestly, they tend to reveal things even that the examinee doesn't want to be revealed. And if you try to lie, it often will be able to detect that. Or if you're exaggerating or minimizing, it has the ability to detect that for the most part. And Dr. Hughes used those, PAI and the TSI too, which is kind of like that, but not entirely. It does have a validity scale, a couple of validity scales. And then Dr. Hughes is saying the other instruments that I used, including all of the interviews and gathering all of the therapy records and talking to the examinee and collateral contacts, family members, that is a multi-method investigation, which, certainly. But I think what Dr. Curry would hope that she would address is that, does Dr. Hughes feel like she sufficiently provided the limitations to this sort of investigation to the fact finder? I think Dr. Curry would say no, and I think Dr. Curry would say that that's unethical. And I would tend to agree, because Dr. Curry, when asked, do you think intimate partner violence was happening? Dr. Curry said, I can't know. I can only tell you what was reported to me and what I heard the individuals reporting to other people. But as a forensic psychologist, I can't comment on that. That's what I was taught. That's what I did. Now, another thing that Dr. Hughes is talking about is that, one, she's saying that Dr. Curry is confused, which, I don't know the consensus in the field of forensic psychology. I can only tell you what people did who taught me and who were supervising me and who were around me. And this was, many years ago. And it's also kind of through a foggy haze of memory. And so who knows? But that's what I remember being taught. Often in graduate school and post-grad work, things tend to be a lot more buttoned up. People tend to be a lot more, playing by the book. So sometimes that's not exactly reflective of the consensus in the field. I do remember one professor who actually taught me, Rorschach, projective personality test, ink blot, that kind of thing. There is science around that. They no longer ascribe to the psychoanalytic model that essentially was just the examiner projecting their own thoughts and imaginations onto, the ink blot. You would show the patients these ink blots, and there were eventually these standardized ink blots that were used, and the patient would say what they saw or just say whatever came to their mind. It's like, oh, that looks like a clown, or that looks like penis or something. And then the psychoanalytic evaluator would code those responses somehow or analyze those responses. And it was found later that that didn't really stand up to scientific scrutiny. It was often completely arbitrary. And if someone saw a clown or they saw pelvis bone, it wasn't clear what that meant. And by the way, all that practice that some people still do in therapy has been completely debunked. Some art therapists will do this. therapists, ethical and trained, competent art therapists will not, or people who use art in therapy will say, if a kid draws a picture and the dad is over here, it's like, oh, dad must be distant, and the data just doesn't support that. It can be a beginning to a conversation for sure, in the same way that there's nothing you can say about someone scientifically based on their dreams. People will claim that all the time on the internet. If you dream about flying, it means this. It's like, no, that's all been debunked. It's all ridiculous when you really think about it anyway. Now, I will do dream analysis with people, but it's not me saying this is what the dream means. I have a method of walking people through their own associations, their own dream, thinking about how the dream might be reflective of their life or emotions or wishes or traumas, and we derive a conclusion based on what they tell me. I don't ever impose on them, and in the end, I can never know if the conclusion is accurate or not. I can just tell you from experience that it's often fruitful and meaningful to a client to do that. So the current science around Rorschach is that there are some things you can determine scientifically from people's responses. There are norms that science has actually looked into, like when people respond to this ink blot in this way, there's a higher incidence of a thought disorder or something like this, and thus you can derive some conclusions. It's not very useful though. All the things we have available to us in terms of trying to understand and assess examinees or patients or clients, the Rorschach test was very labor intensive, didn't produce a lot of insight in my opinion, especially when you compare to other methods. And it was very time consuming and expensive. And so it was fun to learn, and it's fun to know, and it was fun to do. And when I was taking the class, it was fun to do it on my friends and do it on myself. My point is that Dr. Curry is criticizing Dr. Hughes because Dr. Hughes was using the malingering measure as a way of trying to determine whether or not Amber Heard was lying or not. And since Amber Heard did not have scores that indicated malingering or feigning or faking or lying, then Dr. Hughes made this conclusion that Amber Heard's testimony or account when she was examining her to be truthful. And what Dr. Curry was saying was that's used in cases where you're trying to detect if someone is trying to feign a severe mental illness like psychosis, bipolar, this kind of thing. And I think Dr. Hughes is about to say that, yeah, in criminal forensic psychology, that's true, but in civil litigation, we will, in forensic psychology, almost have to use these other methods because otherwise there's no way to investigate the question at hand, like, is someone a victim of domestic violence or intimate partner violence?
Because they are clinically relevant and they still give us very valuable information to individuals who are involved in a court case. And the reason that we do that and we use these clinical measures is because the majority of the people that we see are in a clinical realm. They're not in a courtroom. So they're well-validated and well-researched methods.
And by the way, I consider this to be a very juicy moment in terms of my reaction video life, to have actual clinicians like myself in court having to testify in criticism of each other is, I find, fascinating. It's just so interesting for me.
Different types of tests within that category. We use some checklists, some face valid checklists. We use some tests that are those broadband personality inventories. We use structured clinical interviews, and then we look for the consistency across those data points. And when we use different types of tests, it gives us information about the individual, how they go about these tests in these different modalities.
Okay. I mean, that doesn't really answer the question. I think what she will say, if she's given time, is, yeah, all of the measures regarding intimate partner violence and most of the instruments regarding PTSD are self-report, but I'm looking for consistency in terms of the reports to the therapists in the past, the reports to me, the reports on these measures. And if I see inconsistency, then that shows possible feigning or something is going on there. And what I'll say to that is, okay, but I'm sure Dr. Curry would say, show me the data, show me the research that shows that using that method is an effective way of determining if someone is feigning or not, because I don't think that research exists. Plus, research even shows that when you give people these instruments, it research shows it's very easy to feign that you have PTSD because people know what PTSD, because it's in the culture. So the fact that there's consistency across these domains doesn't say anything as to whether or not she's telling the truth or not. Plus, I have the CAPS-5 that I administered that showed that she was lying.
Dr. Curry seemed to suggest that Amber Heard tested the most extreme category in all of these different tests. Is that accurate?
Objection, compound.
Overruled.
That is not accurate. They were not on the checklist. I mean, people sometimes do. They go, all the time, this happens to me all the time, frequently. And that is not how she endorsed these tests. She endorsed them in a very moderate way, in a very nuanced way, describing her symptoms that I determined was accurate and reliable.
Okay, that tells us something. Even so, that still doesn't mean that someone is telling the truth. Now, I will say that the strongest piece of evidence that I would support in Dr. Hughes' claims is that well previous to the divorce, she's in individual therapy and I think reporting PTSD symptoms to her individual therapist. It would be very unusual for an individual to begin lying that far in the past because they think they might be in a court case 10 years later. It's very unusual. So, and it's very unusual to lie to your individual therapist, particularly about something like that. Is it possible? Yeah, but it's not likely. So on that, if she were to say that, but I don't know what are in the progress notes. I don't know what's documented in terms of the individual therapy that she was in. To me, though, that would be really strong.
Dr. Curry also suggested that Amber Heard was tested very, very high, 98 percentile, I think, on malingering and feigning. Could you speak to that, please?
Sure. So, I mean, she said a lot of things, so let's go through those tests. The first was the PAI, and that's that other broadband psychological
Objection,
measure.
non-responsive.
I think it's very responsive.
I mean, I don't know how these objections work, but she's answering a completely different question. She was specifically asked about the ATR, and she's talking about the PAI. Now, if I was to take a guess, her rebuttal to the PAI criticism that Dr. Curry had is stronger, and she wants to lead with that.
I told you last time that there was no evidence of malingering or exaggeration or feigning on that test. What Dr. Curry was talking about was this tendency to put your best foot forward, to minimize faults on this PAI. That scale was right at the cusp. And then there are two other measures that we look at that to say, you know, is this enough for an elevation for me to consider that as a serious response distortion, of which Dr. Curry was saying, and it was not.
Okay, that was my suspicion because when we heard Dr. Hughes report on the PEI the first time, she didn't mention anything about the validity scales. And when Dr. Curry referenced the validity scales, so the validity scales, there's a number of scales. Basically, they're algorithms based on the responses that people give, and it's based on empirical research, meaning that they actually ask people or find people who are lying, and they compare their response configuration with people who are not lying. And there's various different ways to lie, right? You can lie by exaggerating, you can lie by minimizing, you could lie because you don't really have awareness of yourself, you could be confused. It's not just necessarily lying. Validity scales have to do with lying and minimizing, but it also has to do with people who are cognitively impaired somehow, and they clearly don't really understand the questions. You know, they're answering seemingly in a random way, either because they're impaired or they're not taking it seriously, and the validity scales are there to capture those types of responding. And so I suspected that this was true. You know, Dr. Curry was identifying the validity scales as indicating that it was another indication that Amber Heard was minimizing on the PAI, similar to the MPI, and that Dr. Hughes failed to report that, because you can have mild indications on some of the scales, like maybe one of the scales, which it sounds like that's true, that indicates possible minimizing or feigning or confusion or something. But usually you look at more than one validity scales. There's usually a validity scale constellation of elevations that will indicate this or that. And can someone look at one, you know, on the cusp, as she says, elevation and be like, well, considering what's happening, it's a forensic evaluation, there's going to be a little bit of minimizing, meaning that when the examinee comes on a question that they interpret as, well, it's kind of debatable in their mind, the examinee is like, well, I don't know, I could see it going either way for me. This is for a court case. I'll err on the side of safety and I'll answer in this way. And they do that a number of times. It can look like they're trying to minimize when they're just kind of making a judgment call about those few items that are debatable anyway. Whereas if they were in a safe environment to respond however they wanted, like in a clinical environment, they would have answered in a different way more often than they did. They haven't told us which one it was, so I don't know if I'm describing what's happening right, but I imagine that's what's happening, because that is an explanation as to why she would have an elevated K scale in the MMPI. We did hear that. Is this interesting to any of you? I feel I want to talk about this, so I hope it's interesting to y'all because this is getting way into the weeds. Normally I'm talking about like attachment and conflict, things we can all relate to. But anyway, so I suspect that Dr. Hughes's interpretation of the validity scales, a lot of people would agree with, and I think some people would agree with the way Dr. Curry looked at it, especially if you come from the Dr. Curry perspective that she has borderline and histrionic, and particularly histrionic people are prone to lying or lack of awareness, and you would take that into account, the 3-6 and the elevated K, the elevated validity scale on the PAI, the potential indication of borderline in the PAI according to Dr. Curry, the reports. I'll tell you, I've administered those tests to people who clearly had borderline personality disorder, and they scored in a way that did not indicate they had borderline because of the reasons that Dr. Curry mentioned, because of lack of awareness, because of lying or pathological lying. And some of the questions are hard to detect what they're getting at, but some of them are kind of easy. So I've seen that before, absolutely. And I've been disappointed because these measures are sold as a way of finding out if someone is lying or not, and the validity scales didn't indicate any deception. I know this person backwards and forwards, and they have a personality disorder. In fact, they would probably agree, and some of the people I'm referencing would agree that they absolutely have borderline, and we've been talking about it for years. So the measures aren't a foolproof way of determining that.
What Dr. Curry went back to, which is this 98th percentile, which I told you in the manual, all you have to do is read the manual. It says specifically that we do not use the percentile ranks for this test. That indicates to me that, Dr. Curry does not know the psychometric properties of this test, and then she is therefore not qualified to interpret it.
Okay, so I won't bore you with the details, but a lot of the research on the ATR and the TSI-2, I believe it has 8 items on the test. So there are 8 items that are bizarre symptoms that aren't associated with PTSD. And if enough of these are endorsed, it might indicate that the individual is just saying, yes, I have all these symptoms, and they don't know which ones are PTSD and which are just outlandish symptoms or symptoms of other disorders. And it can indicate that the person is feigning PTSD. It can also indicate that someone not only has PTSD, but they also have other issues like insecure attachment. And I'm wondering if borderline individuals actually will, in a truthful way, endorse these other symptoms, because not only do they have PTSD symptoms, but they also have these other symptoms. Even at the much more conservative cutoff score of 15, this isn't the percentile that Dr. Curry was talking about. It's just the raw score. The false positive rate was still high at 33%. Even as sensitivity dropped to 47. So what I think this is saying is that even if you have a conservative cutoff point that's almost double what the old cutoff point was, which was 8 at 15, which I'm guessing if Amber Heard was at the 98th percentile, I'm guessing she was above 15, but I don't know, then the false positive is 33%, meaning that people with 15 and above responses, scores on the ATR, 1/3 of those individuals look like they're lying, but they're not lying. But, I think that says something, right? I think that raises the possibility of lying. And when you take in all the other data, CAPS-5, all these other kinds of things, then I think you're safe in concluding that Amber Heard was indeed lying. Now, as I've been saying from the beginning, she could be lying about the PTSD diagnosis, but also be an absolute victim of intimate partner violence. Those things are not tied together, but to the fact finder, to the jury, if there's a pattern of lying that is established, then it's hard to know and believe anything she says, right? The other thing I'm reading in some of the literature is that I think what was possibly happening was many people who had been traumatized and been through very difficult circumstances, like refugees or war veterans, were being denied services because the ATR was falsely identifying some people as having faked their PTSD symptoms. And so there was a lot of literature around like, wait. Just because someone is scoring high on the ATR doesn't mean that they're lying, and thus you're just going to reject them from the care that they legitimately need. Plus, if someone is greatly suffering, they might just be responding that way because they're like, please help me. I've been suffering for so long and no one's listening to me. And I heard that I need to pass this test somehow. Like there's a lot of other reasons as to why the ATR would be elevated. But do we think that that was the case for Amber Heard? I mean, she's in a forensic evaluation. She knows that there's a lot of scrutiny on it. So, and she's not in a situation where she's desperate for services. You could claim she's desperate for justice if you believe that she believes that she was wronged, which is very possible. But is it true that the manual says be very wary of interpreting an elevated ATR as indication of feigning? Yes, it does say that. That's what the research indicates.
That score, the one that's elevated, which she's talking about, that percentile rank, has a raw score. Amber's raw score is a 10. The cutoff score is a 15.
We actually have a number. We never get numbers. So we're getting a 10. All right. So you just heard the research, right? When we're between 8 and 14, then there's a very high likelihood of someone, like a 50% likelihood that someone that has that range is lying, and 50% are not lying. So could a responsible, conservative forensic psychologist who has already heard a lot of evidence indicating PTSD disregard that ATR? Absolutely.
She's nowhere near that level of exaggerated symptoms where I can't further look at that test. Secondly, there are 3 scales out of maybe there's about 20, a little more on the TSI that were elevated. Intrusive experiences, that's when thoughts and memories of the trauma come into your mind when you don't want.
Now, I'm having a hard time understanding why that would be at the 98th percentile. A score of 10 is at the 98th percentile.
That Dr. Curry cited in her report. That bolsters the methodology that I used. That in the study that had the PAI, the MFAST, and the TSI in the title of detecting feigned from bona fide PTSD.
Okay, I just went down another rabbit hole regarding the research. It took me a while, but I also see here that some people do, in fact, will feign PTSD, war veterans trying to get services or trying to, I don't know, there were research, apparently there's research by, I believe, the VA trying to determine if this is a big problem among veterans trying to fraudulently get services or something. It's pretty sad to think about that we would deny people services that they need, and that people would have to feign PTSD in order to get those services, which is upsetting. But another notable research finding, according to this study, was that the PAI is actually a better way of determining if someone is feigning PTSD. There's the NIM and the PIM scales on the PAI. 2 of the validity scales on the PAI are even better at determining if someone is faking PTSD, and with an 83% effectiveness rating, which is much higher than that 50% that we saw, or even the 66% that we saw at the above 15 ATR. So I'm guessing that Dr. Curry would have pointed out the NIM and the PIM validity scales being elevated that are even better indicators of someone that is faking PTSD. And since we didn't hear that from Dr. Curry, then I assume that the NIM and the PIM scales were not elevated, which is another indication that Amber Heard was not lying about PTSD. That's interesting. Or that she's just really good at being able to detect the questions that are trying to trick her. And then this other study, 2019, Palermo and Brand, found that the HER scale was only accurate in classifying 60% of the sample using the TSI-2 manual recommendation of 15%, meaning that, if I understand this right, that it's not as 66%, it's as low as 60% in terms of of the people that have a 15 or higher score in the HER, which Amber Heard did not. 40% of those individuals are not lying about it. So, it's a pretty sizable group. Okay, so I think, and I'm trying to find the exact study that she is identifying that actually was looking at. And by the way, I figured out which malingering measure I used back in the day, and it's the SIRS-2. As soon as I saw a picture of, oh yeah, that's right. It's the structured interview of reporting symptoms, second addiction.
Now, Dr. Curry also talked about the danger assessment scale and suggested that you had inappropriately interpreted that. Do you agree?
That's also incorrect.
Please describe for the jury.
Which I told you last time, the danger assessment scale has statistically validated risk factors for serious or lethal domestic violence. Those risk factors exist whether we go forward, we're sitting with someone in an acute setting and assessing them right now, or if we look backward and we look retrospectively about what factors may have been present in a case that indicated severity.
Yes, if you assume the examinee is answering truthfully. Like with the BAI, the Beck Anxiety Inventory, I'm guessing there is research demonstrating that people who have scores above a certain threshold are much more likely to develop depression as a result of the demoralizing effects of anxiety. And so when you administer the BAI to someone and you see a score above a certain level, you're like, there's a high likelihood that this person will develop depression based on the research, assuming the examinee is answering truthfully. Yes, I'm guessing that it is true that the results of this self-report measure are associated with actual danger in the individual's life regarding intimate partner violence. Absolutely, if we assume the individual is filling it out truthfully.
That instrument is used in what there's called domestic fatality review boards. Those are boards after somebody has been killed, a homicide has occurred in a domestic situation.
Yeah. You have a case in which there are facts indicating intimate partner violence, and you're trying to assess the level of danger, I suppose. I don't know the purpose of this measure, but I'm guessing it's something along those lines. Okay, again, factual information demonstrating intimate partner violence. To use it to determine if someone is telling the truth or not regarding the intimate partner violence, I'm just going to take a guess. I'm not familiar with the literature. Dr. Curry said this, and Dr. Hughes has said nothing to exactly refute that. If she said, no, there is a validity scale on this measure, there is research demonstrating that it is detecting people who are lying on it. She hasn't said anything along those lines, which I find to be deceptive. She is asked to respond to the claim and the criticism by Dr. Curry that these self-report measures are not effective in identifying people who have been lying about whether or not they are a victim of intimate partner violence. And Dr. Hughes is saying that this measure is associated with the danger level that someone is going through. I don't know, because she's not directly addressing this, but I think she knows that Dr. Curry's criticism is mostly valid. Now, I wonder if Dr. Hughes, if she were allowed to really describe the full assessment process she went through, she would say, I was not relying on the self-report. I was relying on all the other data that I heard. And she did not sound anything like someone that is lying. I've worked with people who are lying, and given my experience, she didn't come across like she was lying. She didn't have these hallmarks of lying, and she had these hallmarks that indicated she absolutely was suffering from PTSD and was a victim of intimate partner violence based on my experience. I imagine she might say something like that, but doesn't think it's going to fly because you are supposed to, or somehow it's more valid when you provide test measures that can back up your opinions or something. And I don't think there are test measures regarding whether or not someone's lying about being a victim of a crime. It'd be too hard to determine that, right?
They look at these risk factors to see what was there and what could be done.
Right.
So, I don't know, but I'm guessing Dr. Curry would say that she just committed another ethical violation by deceiving the fact finder that the test is a scientific clinically validated measure of determining if someone is lying about being a victim of intimate partner violence. The way she responded basically was saying that given Amber Heard's responses, science demonstrates that she is a victim of intimate partner violence, which I don't think is true. I can't know that for sure, but I'm pretty sure at least Dr. Curry would say that that's true. And for Dr. Hughes to basically, she didn't say that directly, but she basically intimated that. I'm guessing Dr. Curry, that's what Dr. Curry was referring to when she's saying she was being unethical, because the ethical guidelines in forensic psychology are very buttoned up regarding not going outside of the bounds of what you can say scientifically that's backed up by science. And I think that's what Dr. Curry would say, but I don't know.
Criticized your administering of the CAPS-5. Do you agree with her criticisms?
Okay, so I'm extremely curious as to what her response is to this.
I do not.
Will you please explain to the jury?
So the CAPS-5, as you all have heard multiple times, is a structured clinical interview in determining PTSD according to DSM-5 criteria. On this measure, Amber Heard scored in a moderate range. She did not over-exaggerate on this test. She could have said no, mild, moderate, severe, and extreme. All of hers were either 2s or 1s or 0s. Not above that.
I don't think that's what Dr. Curry was saying. What she was saying was that the test indicated that she didn't have the depth of knowledge about the condition to provide details about her experiences with PTSD. I don't think Dr. Curry was referring to Amber Heard exaggerating symptoms on the CAPS-5.
So she's scoring in the moderate range, which still has functional impairments. I mean, we don't want someone to be having moderate PTSD, but that's not an exaggerated profile or exaggerated response style of someone who's answering an instrument.
That's her entire response? What about the blank spots? What about the lack of detail? Okay, I'm looking up other research because I'm just curious, but I found a lot of research demonstrating that there is no gold standard method or single instrument for detecting malingering or feigning in PTSD. So there is no reliable, decided upon consensus manner in which we can test in forensic psychology if someone is trying to fake PTSD, whereas there are gold standards of how to determine if someone is feigning other kinds of disorders like bipolar or schizophrenia or something. However, they do say that there are 3 gold standards to determining if someone is feigning or malingering, generally speaking, not just PTSD. And they mentioned the one that I was trained on, which is the SIRS. They talked about the MMPI-2, and they also talk about the MFAS, which is the one that Dr. Hughes was using. It does say here that the current gold standard in PTSD assessment is the CAPS-5. And these researchers, Ali et al., recommend that when you're trying to determine if someone has PTSD and if they're feigning, you should use a diagnostic interview and the MFAS right off the bat. So it does seem like the MFAS is used to determine, possibly as one way of determining if someone is feigning PTSD. Then you should review collateral data, meaning you look at clinical records and you interview other people who are in that person's life. And then if there's a suspicion based on the diagnostic interview of the examinee, based on the MFAS, or based on the collateral information, if there's a suspicion there, then you want to administer the SIRS MMPI, the SIRS, the one that I was trained in, the malingering, which she didn't use, which I'm trying to figure out why they would have said use the MFAS beginning, and that if you suspect, you would use the SIRS as a second malingering measure. So it does sound like people do use general malingering measures for PTSD feigning detection. And then they say if it's still unclear, then you want to do psychophysiological or neuropsychological testing. I'm trying to find anything that indicates that people use the CAPS-5 in the way Dr. Curry was claiming as an instrument to determine if someone is feigning PTSD, and I can't find anything. Everyone's referring to the CAPS-5 as a good way of trying to get at the full breadth of someone's experience with PTSD because you're interviewing them and to determine severity. It's lengthy and it takes a lot of time, and there's a lot of training involved in the individual administering it, but the procedures of trying to determine if someone is feigning or faking PTSD PTSD, they don't include the CAPS-5 at all. So the way that Dr. Curry was referring to the CAPS-5 as the gold standard is true in terms of the determination of PTSD and the severity. It's apparently not that great at determining if someone is feigning or not. Could someone use it that way? Sure, if the responses were considered to be very surface level, but that's not the way it's designed. That would just be product of one's personal experience that they are infusing into the assessment process, which would be fine, but you couldn't claim that the CAPS-5 found that an individual was feigning, which throws a lot of what Dr. Curry said into doubt. I'm having a hard time finding any indication that the CAPS-5 is ever used as a reliable way of determining if someone is feigning PTSD, whereas the MFAS, which is what Dr. Hughes did administer, is considered to be part of the protocol in addition to interviewing, using the SIRS, using the MPI, and possibly using neuropsychological testing. It is at least the common way in which people will try to determine if someone is lying. The other thing that I don't see a lot of people using is a TSI-2 as a reliable way of determining, that validity scale, the ATR. I think what it says is that it's hard to determine if someone is faking PTSD. Dr. Hughes, looking at all the data, says she isn't, and Dr. Curry says she is. And they probably both have a foundation to base their conclusions on because there's no reliable way of determining that to begin with.
Because this is, we're not just administering them like robots, is you go and you do a clinical assessment. And that's what I did. I took what she wrote, what she endorsed.
Which is what I thought she would say, which is right for her to say.
They couldn't hike, they couldn't move, they couldn't function in any way, shape, or form. Thank you.
No, that is not correct. That is often actually a myth and misconception about individuals who were struggling with PTSD or.
Right. I pointed that out too. I thought that Dr. Curry was stretching it a little bit. She was heading into Dr. Spiegel territory with that claim that somehow the evidence or the facts that Amber Heard had gone to events or gone hiking or had acted in a movie somehow indicates that she couldn't possibly have PTSD, which I immediately was like, whoa. You can't know that for sure. I was saying she could be massively suffering during those events. Maybe the hiking or the acting actually is a safe place for her.
To hit that pause and shut it off again. So they still have, impairments in other ways, but they go about their lives. They're not, totally debilitated. If you have someone in that high range, the highest score is an 80 on the CAPS, Ms. Heard had a 28. If you have someone in the higher range, we have seen people who are, severely disabled because of it, but that's not the norm of people who have this moderate PTSD.
Yeah, absolutely. Totally agree with everything that she said. I'm glad that she even included that at the end, which is, sure, if you have severe PTSD or comorbid issues such as drug addiction or poverty, these kinds of issues, or lack of access to care, or you're currently being harmed by people around you, then sure, your life can absolutely become non-functional, where you lose work or you become homeless, this kind of thing. For sure, that will happen, and the root cause of all that is untreated PTSD, but that's only in special circumstances.
And did you find functional impairment with Amber?
Yes, I did.
Now, Dr. Curry also said that it is not within the scope of a psychologist to evaluate domestic violence. Do you agree with that?
Of course I don't agree with that. This is what I do for a living, day in, day out, for 25 years.
Right. So when Dr. Curry did this in the very beginning, she was being asked before we ever met Dr. Hughes or Dr. Spiegel or anyone, and Dr. Curry responded to the question, do you believe IPV was happening? She says, I can't answer that question. I don't know. I have people's reports, but I don't know. And I said, that's the way I was trained to answer that question, and that would be the way I would answer the question, whether I was a forensic psychologist or just in court for some other reason, which would happen often. I would be called into court, and I don't know how I learned this, maybe the hard way, that when I would be asked a question by another clinician, say I'm just conferring with another clinician and they say something like, do you think that there's abuse happening in the family? I might, given the scenario, I might say something like, yeah, I do, because this, and this. But if I'm in court and someone asks me that question, I would say, I don't know. I only have what people are telling me. If they really pressed me and said, well, what's your personal opinion? And I would say, well, my clinical opinion is that it's highly likely that the reports are accurate because because of these 5 reasons. But I can never know in this setting in court, if you're asking me to state a fact or a clinical, scientifically based opinion, I can't make that claim. I can only tell you that it's highly likely, given my experience, that the reports are accurate. So Dr. Curry answered in that way. Dr. Hughes answered in a totally different way.
Now, Dr. Curry suggested that you made a determination just based on personal opinion and just on checklists and a couple of tests that you misinterpreted. Would you agree with that?
I vehemently disagree with that. As I stated to you, over 29 hours and 12 psychological tests and reviewing a slew of documents in this case, most importantly, therapy records and interviews, collateral interviews with therapy.
Right. So that's good that she emphasized that. Most importantly, the therapy records and interviews that I conducted.
Using all that data, that is what a solid forensic methodological exam looks like. And then I made my conclusions based on my clinical education, knowledge, and training to come up with a professional expert opinion.
Right. That stands, totally stands. And I think that that's a respectable answer to the criticism. Absolutely.
You were qualified as an expert in forensic psychology with a specialty in domestic violence and in trauma, correct?
Correct.
Right, and that is a good point to bring up, that Dr. Curry does not have as many accolades and experience as Dr. Hughes does. So that's an important point to bring up for sure. Not to say that Dr. Curry is inexperienced, because she is experienced.
Your disclosure reads, Ms. Hurd's responses on the PCL-5 support a DSM-5 diagnosis of post-traumatic stress disorder with an etiology of intimate partner violence she experienced by a former partner. You remember writing that?
That's correct.
Okay. You just testified that you need to read the manual, right?
Yes.
Okay. Can we put up 1311 as a demonstrative?
Okay, so I think what Cross is trying to do, which I don't think is going to work on the jury, it certainly isn't going to work on me, is that they're claiming that Dr. Hughes had diagnosed Amber Heard with PTSD after using the PCL. That isn't what she's saying. What she's saying is, sure, she used the PCL, but she used other instruments, and she also did a lot of interviewing, including a diagnostic interview, collaterals, gathering of the therapy records. So might the topic sentence be the way he described it? Sure, but that's not what was really happening.
The PCL-5 should not be used as a standalone diagnostic tool. When considering a diagnosis, the clinician will still need to use clinical interviewing skills and a recommended structured interview, the CAPS-5, to determine a diagnosis, correct? That's what the manual says.
Right, and this manual
Okay.
also says that this is a screening instrument, so when you do the clinical interviewing, you absolutely can determine diagnosis
So the
after
answer is
somebody
yes. The manual says you
still
the
need to use
PCL-5
clinical interviewing skills, which I used.
Well, let me finish my question. The PCL-5 should not be used as a standalone diagnostic tool, and they recommend using the CAPS-5 to determine a diagnosis, correct?
It does say that, yes.
Yeah, and you made your diagnosis before you did the CAPS-5.
Okay, so if the actual manual specifically identifies the CAPS-5 as something that should be used in addition to the PCL, and you don't use the CAPS-5, then what does that mean? I think a lot of forensic psychologists, and myself included, would say, well, I don't need the CAPS-5 to diagnose someone. It takes a long time to administer. It's unnecessary a lot of times. What she's going to say is, yeah, I didn't do the CAPS-5, but I don't need that because I did a very comprehensive clinical interview process, diagnostic interview, collateral interviews, and I didn't need the CAPS-5.
I made my diagnosis doing clinical interviewing and 11 other psychological tests that supported diagnosis of PTSD and symptomatology consistent with PTSD.
Okay. You said that we should read the manual. Would you also agree with me that we need to read the directions?
I mean, I guess cross is going to cross, so you're going to try to cast doubt, and if this works on the jury, which, I could see it working on the jury, particularly if you're already determining your decision as a jury member, that it's like, this is just another example of Dr. Hughes being shady. And does it cast doubt? maybe a little bit, but it doesn't to me.
That I oriented Ms. Heard to a different time frame because she was already out of the relationship.
Okay, maybe we should back it up a little. This is the CTS-2 that you administered as part of this battery of tests that you indicate you did in relationship to your diagnosis.
Right, this is the conflict tactic scale 2.
And you'll agree with me that this test specifically asks, in front of every single question, how often did this happen in the past?
Yeah, we've already been over this. I doubt that this is working on the jury. I suppose it might be. She already answered this, and it's a perfectly valid way of answering and administering this test, in my opinion, that in all the questions, it does say in the past year, but Dr. Hughes stated she oriented Amber Heard to not answer for the past year, but to answer for when she was in the relationship or the final year in a relationship with Johnny Depp, which would have been a few years prior.
Correct, and I oriented
And
the
you
individual
know,
to
I
not limit
think
herself
it's
to the
correct.
last year to get an accurate assessment of the violence and abuse that she experienced in the relationship.
Objection, Your Honor, move to strike.
All right. I'll move to strike the last part of the answer. Strike the last part of the answer. Thank you.
I mean, I'm trying to figure out what would be at least a more effective cross for me. And of course, I'm guessing I'm not a typical juror because I am a clinician, and I'm just going to take a guess and say that most of the jurors, if not all of them, are not clinicians in mental health. I've said this earlier, but when I was called to jury duty, I would often be excluded immediately, regardless of the case, because I said I was a mental health person. So I'm trying to figure out what other cross. Well, I would really hammer her, and maybe he will, about why were there blank spots in the CAPS 5? Is that the standard way of administering it? How do you explain that? Because I'm curious as to what her response would be to that, because I don't think there is a valid response to that. So that'd be one thing I would inquire about to make her look like she is either not competent or sloppy or biased or something. The other thing that I would ask her about is, does she believe that some forensic psychologist would conclude that the MMPI results does indicate a strong enough 3-6 code type? Because if she answered honestly, I think she would have to say, yeah, I do know some people who would interpret it that way, but I don't, and the people who know what they're talking about don't, or something like that, just to kind of point out the fact that her claim that the 3-6 code type as being invalid is not generally agreed upon in terms of the results. Oh, another line of questioning I would go down is, I would say something like, okay, so you're very experienced with PTSD in assessment and treatment and research, trauma, intimate partner violence, and we can establish that. However, is it possible that an individual, never mind about Amber Heard, but hypothetically, is it possible that someone could go to therapy years and years ago and either be distorted or lie or leave significant information out and report a bunch of things that would be mistaken by the therapist as a report of PTSD and intimate partner violence, and then they do that throughout the different therapy that they're in, and then later on during a forensic evaluation, they continue to lie and or because of their distortions, report that they not only have PTSD, but that they also have been a victim of intimate partner violence. Is that possible? Because one, by asking a question like that, and I don't know if you're allowed to ask questions like that. Attorney Allison, is that her name? Is that possible? If you were allowed to ask such a question, one, you'd be telling the jury, look, there's a way that Dr. Hughes is accurate, but just not considering this other possibility. And we all know that Amber Heard tends to lie sometimes. You're trying to capitalize on that idea. So if she says, yes, that's possible, case closed, right? If she didn't answer in the affirmative, Dr. Hughes would come across as biased, because she would, I think, come across as someone that is refusing to acknowledge or has a blind spot in her ability to evaluate people, or just has a bone to pick with, I don't know, perpetrators that she's determined as perpetrators. If she said, no, that's impossible, that would never happen, I think that would cast doubt on her entire testimony. So that would be another question that I would ask. Let's see what sort of other things I ask.
Next question.
Yeah. And you know that at the time that you gave this test to Ms. Heard, she had been away from Mr. Depp for far longer than a year, correct?
which is why I oriented her to a different
Yes or no,
time
ma'am?
frame in answering the questions.
Doctor, yes or no?
So, of course,
Okay, you knew she was gone for more than a year.
of course.
All right.
And that's savvy as well to answer, of course, because if you answer yes, then it could come across like you're admitting guilt or something. But if you answer, of course, it's saying yes, but also, I always knew that. This is obvious. You know, you're not claiming that you've been caught on some sort of deception.
You talked about the danger assessment test.
That's correct.
All right.
And just to contrast both the cross-examination of Dr. Curry and Dr. Hughes with the cross-examination of Dr. Spiegel. And just compare the way that Dr. Spiegel reacted to cross-examination and how seemingly flustered he was, how seemingly incompetent he was. I don't know, but according to my eyes, he just didn't seem to know what he was doing a lot. He said things, in my opinion, that actually harmed his case. You know, he said, absolutely, Amber Heard has borderline and histrionic. Absolutely, she has signs of it. I'm like, he wasn't even asked that question. He just volunteered it when he was being asked about narcissistic personality disorder traits being associated with intimate partner violence. And he says, look, I'm not going to say that. I'm just saying that all cluster B symptoms are associated with intimate partner violence. And it's like, well, one, you're saying yes because narcissism is a part of cluster B, and you're bringing Amber into the equation. So why are you doing that? Now that I think about it, it's possible that when Dr. Spiegel was saying that there are general descriptors of cluster B, dramatic, these kinds of words, that I guess he's claiming are associated with intimate partner violence.
With respect to frequency, is the answer to that yes or no?
I don't know what you mean, a single blank.
All right, let's keep going. All right, we'll stay at this page for a second. This is the very first box you're asked to fill in as to, I think, a fairly fundamental question, right? What happened?
We talked about this before, Mr. Dennison. I had 88 pages of notes of what happened. It would have been redundant to put it there.
Well, that's dubious. What Dr. Curry would say is, this is an invalid test because you didn't fill it out. One of the questions is, what happened? How old were you? So it's probably the first question that one asks on the CAPS-5. And you see there that, there's a spot there. Say you have really bad penmanship or there's a lot of response to this, then you might want to write on a different piece of paper. Okay. Now what she's saying is that she already had the answer to this question. I don't know if that would fly with a lot of people. I certainly wasn't trained that way. What they would say to me is, okay, good, but re-ask the question and get the answer. This is a standardized protocol. You can't, because that would throw out all of the structured interview measures. So according to what she's saying, I think, is, with one of my clients I've been seeing for 10 years, I could take this measure and literally not even administer it to the individual and just answer based on my notes and my memory and then code that? No. You need to administer it because it's normed on the exact way that they answer these questions within the time frame that you have, which is important. Now, could she say, well, yeah, I didn't comply with CAPS-5, and so thus, if you want to throw out the results of the CAPS-5, that's okay, but I don't need the CAPS-5 to be able to evaluate someone because I know that she has PTSD, and the CAPS-5 isn't an indication of whether or not someone is feigning anyway, and I'm a better gauge as to whether or not someone's feigning, so you're just going to have to believe me. She could say something like that, but so I'm really curious as to what she says. Now, there's a definite possibility that I just don't even know what the considered flexibility is to the CAPS-5, but I'm pretty sure.
You know that you are obligated to produce this test in a way that other people can meaningfully review them. Yes?
The people in this case who are meaningfully reviewing them have my 88 pages of notes.
All right, but you chose to put absolute...
Right, so that's another point, that you can't submit this as a forensic instrument because other people don't have what is in your head. It's in your notes, but you're also kind of compiling that in your mind because I'm guessing she says lots and lots of notes. Okay, well, then fill it in, but still, that's not the protocol. This is an interview. You ask the person the question and you write down their response, and at the end, you code that.
Absolutely nothing in the box, the standardized box, that said what happened.
You don't have to put it in the box if you have it somewhere else. It's
Because
not a,
this
if
is
it's
not
not
a standardized test?
well, if it's not a research instrument that is used for research, if you're using it for a clinical diagnostic purpose, no, you don't. If you have that data elsewhere.
Okay, so she's claiming that it is standard to utilize previous notes to fill in the gaps so that you don't have to ask these questions and you don't have to write down their responses. Okay, I'll take her word for it. It sounds unusual to me. Now, in a clinical interview, absolutely, because you're not submitting this to a court. You're not trying to make a claim. It's not going to be reviewed by another forensic psychologist who is adversarial to you. So if for me, for example, and I were to utilize something like this, I might, but then again, why would I do it to begin with? Which, just raises the whole question, why'd you do this to begin with? And of course, what Dr. Curry will say is that she scrambled to do this because she knew that Dr. Curry had administered this, and so she wanted to get out ahead of it. But you would think you would fill it out in a legit way so that there would be no question as to its validity.
Okay, let's go another page or so.
Okay, we're finally seeing the CAPS 5. On one hand, I don't feel comfortable with her clinical material just being blasted on the internet, but on the other hand, it's a court hearing, and on the other hand, I zoomed in, I can't read it. It's too blurry. So there's some of it that I can read, and it looks like standard responses to PTSD to me. Could someone lie on the few sentences I can actually read? Absolutely. But, okay.
You filled in the blank about frequency.
All right, so they have zoomed in here. In the past month, have you gotten emotionally upset when something reminded you of the trauma of the IPV? The verbatim responses, I'm guessing, are all the time. I try to manage my breathing. I get tense, try to use strategies, some days worse than others. Okay, pretty standard response to PTSD. Then it says, how often has this happened in the past month? It doesn't have any indication, but this is what I suspected, she circles the moderate, which is at least 2 times a month. So she doesn't put the amount, but that would be standard. You'd want to have, especially for reviewing purposes. Severe is 2 times a week. So between 2 times a month and 8 times a month. So somewhere in there. And she didn't write it on the blank, but she circled it on the right on the coding. And I think that's perfectly fine. And then it also said circle that the amount of distress, and it says pronounced. Okay. Really hard to talk about this, really hard to look at myself in that way. Negotiating to stay in relationship. I'm still trying to get out. Okay. So what does that tell us? I would be more convinced, and maybe this is what Dr. Curry was talking about, if I heard something more specific to PTSD in that final response. You can't really see it on my screen over here, but I can see it on mine. And something, but who knows? I wasn't there. But if there was a response, something like, when I see his face on a billboard, or when someone reminds me of him, or I smell something about him, or one time I was watching a movie and I saw a man who got really intense and angry, it was someone on the screen, and it wasn't exactly emulative of what I went through with Johnny Depp, but I immediately had all those panic feelings, and I was in the middle row of the theater, and I just burst into tears and ran out of the theater and went to my car and I cried. That would be something that I would say, oh, at least someone knows how to lie really well. But that also sounds like a very quintessential experience of PTSD. Does everyone with PTSD have that? Absolutely not. But something along those lines. But instead, the response is, in the past month, have you gotten emotionally upset? And Amber Heard says, all the time. I try to manage my breathing. I get tense. Try to use strategies. Some days are worse than others. Okay, is that an in-depth description? No. Could someone lie about that? Yeah. But does that mean someone's lying? No. But then when we get, how often has this happened? Really hard to talk about this. This is really hard to look at myself in that way. It's really hard to look at myself in that way. Not sure what that means. Negotiating to stay in relationship. Oh, I'm still trying to get out. So I think what Amber's saying is, I don't know, I'm just speculating. It's really hard to look at myself that way because I was trying to stay in the relationship. I think that's what she's reporting. It would be helpful for a reviewing process if Dr. Hughes wrote in full sentences, and this is something that I will ding my students all the time. I'll be like, if I, as your supervisor, can't tell what you're saying, then you have failed in your documentation, right? Isn't that the reason for documentation? I don't say it in that way, but I'm thinking that. So I will say, use full sentences. Don't use phrases. It just really aggravates me, especially as people are typing this into a computer usually. You're not wasting ink, right? So type, I said this. Don't say phrases like trauma discussed. Well, actually, that one would be okay because at least I would probably understand that one. But there are other phrases like this one, like really hard to look at myself in that way, negotiating to stay in relationship. So negotiating to stay in relationship. It would be much more helpful if we had some full sentence there. I was negotiating to stay in the relationship back then, and it's hard for me to look at myself in light of that. Or when I look back at the fact that I was trying to negotiate to stay in the relationship, it's hard for me to talk about it. And I'm still trying to get out. So I don't know what that phrase means, is that there's reports that she was still trying to get back into the relationship. I don't know if they're truthful, but people saying that, I think one of the people who were testifying said that years after, Amber was still pursuing him, and maybe he was pursuing her. It wouldn't be unusual for a relationship of that volatility to have a long tail after a breakup, that they occasionally will toy with the idea of getting back together or get back together completely. But anyway, so yeah, I don't know. But I think what Dr. Curry would say is that second response has nothing to do with PTSD. It says really hard to talk about this. Okay, if you have PTSD, it would be hard. But also, if you just don't like remembering the shame or the difficulty that you went through in the past, then that would also be hard. Really hard to look at myself in that way, negotiating to stay in the relationship. I don't even know what that means, but so along those lines, that whole response that I'm looking at could be thrown out. You're just like, well, that basically is a non-response, so we're just going to ignore that because I don't even understand what that's saying, and thus there's not strong evidence.
There's a blank in many of these items that asks number of times. You didn't fill a single one of them in, did you?
Right, because I filled them on the right side of the instrument where I am scoring it.
And that is the way that you believe that you followed the instructions.
Yeah, they keep really hammering on this point in the past year and not filling out that blank. Okay. I think you could much more easily hammer on the fact that she didn't fill out the form in terms of the verbatim responses.
Well, you need to understand when you're trying to evaluate the impact of something, you have to understand what happened to the person. And that's sort of the core and the basis of trauma-informed care and of trauma diagnoses. You have to understand, the traumatic event and how it transpired and how it played out for that individual so that you can better assess for the symptomatology that's falling from it.
To summarize my thoughts, because I think we're at the end of this, what do I believe? I believe that the recordings and the videotape of Johnny Depp slamming the cabinets, other kinds of reports, witnesses that I've yet to fully review, indicate that there was a lot of aggression going both ways, including Johnny Depp. That Johnny Depp was verbally abusive, clearly. He said some really awful things. He wrote some awful things in a scary way, I think seemingly to intimidate her and scare her, to write in blood and that kind of thing. Now, you could argue that it's a cry for help of some sort, but anyway, pretty scary, intimidating things, threatening to hurt himself with the knife, slamming things around, physically aggressive at times. He probably was initiating of physical violence at times. I mean, the amount of volatility that they've had, I wouldn't doubt that there were times when he was physically assaulted. The claim of him doing a cavity search for substances sounded too specific and outlandish to be a lie, and so common. I mean, not that specific behavior, but the category of of psychosis-induced abusive behaviors. It's so common to people who will utilize the sort of drugs that he was using, particularly cocaine, and the amounts that I think he was using, that I tend to believe that one. I haven't reviewed the SA allegation from her, the different one, the one involving a bottle, but that could have happened as well. Could have been psychotic influenced. I don't know. Could have been abuse influenced. Could have been him relatively sober doing something that's pretty awful. I know for some people, they would say, well, Johnny Depp would never do that. And what I'll say is, you don't know crap about anything. None of us do. I have worked with very nice, compassionate, good people who have done much worse than that and will admit it to it and tell me about it. And you wouldn't believe what people are capable of and what trauma can do to people. Of course, the vast majority of people who've been traumatized would never do anything even close to that, but it happens. So it's possible he did it. There are allegations that she stole that story from Ms. James, her former personal assistant. I don't know. That seems a little dubious. A lot of those claims that people are making online, like I recently saw one, someone emailed me this video clip of what looks to be Amber Heard she's looking like she's taking notes on her notepad, but looks like her pen is not touching the page. So it just looks like she's feigning taking notes as a way of acting like she's taking notes. And I find that allegation or that suspicion to be kind of strange. I mean, one, why would she do that? Two, it wouldn't be that hard to put the pen on the pad and fake writing. You could write anything. You just be like, I'm taking notes. Like, if you really wanted to make it look like plus there's people pretty close by, including the other attorneys, so why would you do that? Plus the way that the camera angle is and the lighting, it's very possible that the pen is touching the piece of paper. It just is hard to tell because it's really grainy and the color of the tip of the pen is very similar to the color of the page. There just seems to be a lot of conspiracy theories flying around about Amber Heard, and so this allegation that somehow she stole a story from Ms. James, I find to be, possible, but not likely. Is it possible that she made up the entire story? Yeah, that is possible. And if I were to take a guess as to what things she did fabricate, I think I would put that story on the list. I wouldn't put the cavity search story high on that list. I would put that one as a story that I believe. I also would believe that she was headbutted by him that one time. That did seem quite likely. We did see an injury there. The way that even Johnny Depp described it, I wouldn't be surprised that he either was trying to hit her kind of, but didn't mean to hit her that hard with his forehead, or who knows. I mean, the amount of rage that you would feel, even if you didn't have issues, if someone was hitting you, and you just imagine the amount of yelling that they were doing back and forth. So I tend to believe that he did do that. I tend to believe that some of her stories about holding her down. Anyway, point is that could all of it be lies? Yeah. Could Johnny Depp be telling the complete truth? Sure. Not likely though, but I don't know. So having gone through those experiences, compounded by what she went through as a child, could she have PTSD? Absolutely. It's not hard to imagine that, right? Just that one cavity search event alone would be highly traumatizing. I mean, just imagine your partner has just a look on their face. Some of you know this look. Some of you have been through that, where you are not a human being to them. You are a piece of meat or something, and you're the enemy, and they have very wild thoughts, and they are forcing you to succumb to a cavity search of some kind, and they're sure that you're the enemy, and that it's terrifying. And that can absolutely, just that one alone, if we believe that to be true, which, could be not true, but who knows, could all that have happened? And could she have PTSD? Absolutely. Could she also have participated in an equal, if not greater amount of verbal, emotional, physical abuse? We didn't hear any allegations of SA, but could that be as true? Yeah. Could they both do that and one person have PTSD and the other person not? Sure. I'm kind of landing on that possibility. And given what we've heard from Dr. Curry, Dr. Hughes, I'm tending to think that she did have legit PTSD. Maybe not severe, but legit PTSD, given Dr. Hughes' expertise. Could it be not super pronounced, such that with Dr. Curry, it didn't really show itself in a clear way? Okay, maybe. Could Amber Heard have tried to appear as if she had more PTSD symptoms when she was with Dr. Curry on the Cas5? Okay. Could Amber Heard have been intimidated by Dr. Curry and gave really short responses and became kind of flustered? Could Dr. Curry have even encouraged that by being sort of cold with her? I don't know. Somehow I doubt that, because, the whole giving her muffins or something in the morning and trying to get her to relax. Who knows? Do I believe that she has borderline? Do I believe that if I were to evaluate her and she were a willing participant, that I would conceptualize her as having borderline? I do, given everything that we've heard. That doesn't mean that she's a liar. Do I believe that I would find histrionic? I don't know. There's not a strong indication of that. If she is lying a lot, could be, but you could consider that as a part of the borderline desperation and distortion. Do I believe that she's lied on the stand? Yeah, I do, because the picture alone and I haven't seen the full testimony, so maybe I'm wrong about this, but that one side-by-side picture where it's clearly the same picture. I mean, it's obvious. Anyone who knows anything about anything knows that it's the same picture, and especially if you know things about Photoshop or filters or anything, you know those are identical. That's the same picture, and one was filtered and one was not. And the fact that that's even debated, I find just to be ridiculous. And the fact that they even tried to claim that but I don't know. So if I'm right about that, because someone emailed me that clip, then that's a lie. Does that mean that she's lying about everything? No. She could be lying about some things, or a minimal amount of things, and the rest she's telling the truth about. A lot of her testimony I found to be believable, honestly. So there were some moments where I thought, well, that's getting a little questionable in terms of the way she's responding to that, the kind of way she's responding. Johnny Depp, could he be lying? Yeah. Do I think he's lying? Yeah. Or he doesn't remember, which is another thing. But I think there weren't a lot of moments of lying. I think that the headbutting incident, I think, seems a little dubious. He claims that she had nail polish on her nose, on the tissue in her nose. That seems like a pretty outlandish claim, and if it were true, my goodness. But, I could see him fabricating that because he doesn't have evidence to back that up. He testified there was no contact between his head and her nose. He knows that for sure. I find that to be dubious because it sounds like a very intense, chaotic struggle, and you're face to face with you're bear hugging someone like this, and they're similar height, right? And the fact that for sure that your head didn't hit her nose, it just doesn't seem likely, right? So I don't know, there's just some things there. I don't know if he just misremembers, or do I believe that she threw the bottle at him and it took his finger off? Yeah. Could I see it going a different way? Sure. There's some evidence indicating that he would threaten to hurt himself in response to Amber Heard, or in the throes of their conflict.
What was included in the 88 pages of notes?
In the 88 pages were many of the documented incidents of intimate partner.
Objection, Your Honor.
All right, well, that does it for that episode. Everyone out there, please take care of yourself because you deserve it. You really, really do.